This is the final presentation on the brainstem, where we are going to do trigeminal and auditory pathways. So the trigeminal pathway is with regard to sensations from the face area, and the auditory pathway, of course, is for hearing. Now let's look at the trigeminal pathway first. And if you look at this image, you should all know by now that the trigeminal, or the fifth cranial nerve, is divided into three branches. One is the ophthalmic, second is the maxillary, and the third is the mandibular division. The ophthalmic and the maxillary are purely sensory, with the mandibular division being mixed. That means this is the division which has both motor and sensory components. In this image, you can also see the distribution. So the ophthalmic division is for the upper part of the face, includes the side of the nose, the eyelids, and goes up. The maxillary division is for the cheek and the upper lip, and the mandibular division is for the lower lip, the angle of the jaw, and part of the ear. The trigeminal nerve also, if you remember, carries impulses from the supratentorial part of the dura mater. So this is that area. It also carries impulses from the nasal cavity and the oral mucous membrane. And the rest of the pharynx, the impulses are carried by the 9th and the 10th cranial nerves. And a part of the ear has the 10th cranial nerve and the 7th cranial nerve. But they all actually send their sensations into the trigeminal itself. Now, to understand how the pathway works, I would first like you to understand how cranial nerves work. And again, I'm going to compare that to the spinal cord. So let's say we have the spinal cord up here, and this is the gray matter, central canal. In a spinal nerve, that's the dorsal root ganglion, and then this is the spinal nerve. So if you remember, the sensory fibers in a nerve went through this way. The motor fibers began here in the anterior horn cells. They came out and they were present in the spinal nerve. Now, cranial nerves are not all the same. In some cranial nerves, what you have is those which are entirely motor, and let's take, for example, the 12th cranial nerve, which is in the medulla. So in the medulla, so let us draw the medulla. So this is how we'll draw the medulla, and I'm only drawing one side of the medulla. So this 12th cranial nerve, which is entirely motor, it just has the 12th nerve nucleus. So this is the nucleus which is equal to this anterior horn cell. So these fibers which come out are only the motor part of the 12th cranial nerve. So it doesn't have any sensory component. So in other words, this part is totally missing in the 12th cranial nerve. So let's take another nerve. Let's take, for example, the facial nerve. And for the facial nerve, we'll draw the pons. And what I'm going to do is just erase this so that I keep this spinal cord intact. So again, I'm going to draw 1/2 of the pons. So again, if you remember the pons, that was the basilar part of the pons, and up here, that was the 4th ventricle which was open. And here you have those pontine nuclei present. Just to refresh your memory, this is the midline. And if you remember the 7th cranial nerve, when we drew it, so let me use this color. This was the 7th cranial nerve. It wound around and went out like that. So this is the part of the 7th cranial nerve that goes off this way and goes to supply the muscles, and these are muscles of facial expression. But the seventh cranial nerve, the functions of the seventh cranial nerve or the facial nerve are it supplies the muscles of facial expression. It carries taste fibers, which are part of the tractus solitarius. So this is a sensation. This is of course motor. It carries impulses from the posterior part of the ear, so from the skin of the ear. So that again, it's a very small region, so that's also a sensory area of supply. And then applies the lacrimal gland. So the lacrimal gland and the salivary glands, now these are glandular, so this is motor. So here we have taken care of the motor fibers for the muscles. The part which supplies the lacrimal and salivary, this is the parasympathetic component. So it has a parasympathetic component with it, and this is the lacrimatory or the salivatory nucleus. So again, cells are here, fibers begin from there, and they travel out with the seventh, and they go to supply the lacrimal and the salivary gland. So it's almost as if, the parasympathetic component would have been here, if you remember, in the spinal cord, and then it would have traveled out this way. So that's what I'm comparing it with. The sensory components should be in, so I should draw that in green. So the sensory components are for the taste and for skin. Now for taste, if you remember, there was a nucleus of tractus solitarius, and that nucleus of tractus solitarius was present mainly in the medulla. So let me just kind of draw the nucleus of, I'm going to draw the nucleus of tractus solitarius just here to say that it has reached the pons. This nucleus is all the way down. In other words, it's a long nucleus like this. And the seventh will go and relay in the upper part, the ninth, let's say, in the middle, and the 10th in the lower part. So this nucleus of tractus solitarius we can compare to the dorsal horn. So here it is, that is the nucleus of tractus solitarius. And in this case, these impulses were all going this way. In this case, what would happen is that the fibers would pass in, they would have their cell body in a ganglion belonging to the seventh nerve. So in the seventh nerve itself, like this, there's a ganglion which is called the geniculate ganglion. The fibers go in, and then they relay in this nucleus of tractus solitarius, and from here then the next order starts, and that's called the tractus solitarius, and it goes to the taste area. So can you see the seventh, therefore, is like a spinal nerve. It is a mixed nerve. Now, having understood this, let's look at what the trigeminal nerve does. So in the case of the trigeminal nerve, and I'm going to draw, instead of drawing each section, I'm just going to show it to you this way. So that's I'm showing you the brain stem. So this part is the midbrain, this part is the pons, and this part is the medulla. Now the trigeminal nerve is a mixed nerve, but what happens is that it has three main branches. So of the three branches, it's only the mandibular part which is mixed. The ophthalmic and the maxillary, these two parts are sensory. So that's one important thing to remember. So in other words, it should have cells which will receive sensory impulses, and then it should have cells which will give rise to motor impulses. So let's see how that happens. So we have a sensory nucleus which actually, instead of being in one spot like we had in the facial, like here we had the sensory nucleus which was only in one spot. In the case of the trigeminal, that sensory nucleus is actually extending all the way down in the brainstem. And then it gets divided into, it's given different names because each nucleus receives different sensations. So it's given different names. In the midbrain, it is called the mesencephalic nucleus. In the pons, the upper part of the pons, it's called the principal sensory nucleus. and in the lower part of the pons and in the medulla it is called the spinal nucleus. Now this fifth cranial nerve, if you remember, it was attached to the pons. It came out from the pons. So this was the fifth cranial nerve which was attached to the pons. Now when this fifth cranial nerve, where it is attached to the pons, it's kind of attached by two roots. So there is a big large root and then there is a smaller root. So it is, again, if we want to compare, in the spinal cord, remember how a spinal nerve was attached by two roots? So similarly, the fifth is attached by two roots. They are very close to each other. The larger one is the sensory root. The smaller one is the motor root. Now this larger sensory root has a ganglion with it, and this ganglion is like the dorsal root ganglion. This ganglion is like the dorsal root ganglion. And this one is the motor root. Now the fifth cranial nerve, we had three branches of the fifth cranial nerve. So I'm going to do that part here, and let me just erase this since we don't have too much space. So here what I was showing you was that this is the sensory root which enters with its ganglion, and this is the thinner motor root. So this is the nerve. So let's say this is how they are. Now this nerve has got three branches like this. So just as a spinal nerve, so compare this part to the spinal nerve, and the spinal nerve had rami. So think of these as three branches. This one is the ophthalmic, this one is the maxillary, and this one is the mandibular. And the ophthalmic and maxillary were purely sensory, the mandibular was mixed. So let's see what happens. So I had used the green color for sensory. So from the ophthalmic and from the area that the ophthalmic supplies, impulses will go in. They will have their cell body in the trigeminal ganglion, and then they will enter the sensory root. From the area that maxillary supplies, again impulses will go in, have their cell body in the trigeminal ganglion, enter the sensory root and get into the pons. From the mandibular, the same thing. They have their cell body here, and that's how they enter. Okay, so now I'm going to show you. So now what is the purpose of these three nuclei? Just as we had in the dorsal horn, if you remember, in the dorsal horn, these cells up here, when there was a synapse and fibers crossed over, these cells were cells which received pain and temperature and that crude touch impulses. Whereas those impulses which were carrying proprioception, if you remember, they traveled in the dorsal column, went up, and then you had a separate nucleus, the nucleus gracilis or cuneatus, which received those impulses. For unconscious proprioception, if you remember, there were cells here called the nucleus thoracis, they received impulses. So similarly, these different nuclei present in the trigeminal, they are responsible for receiving different impulses. The spinal nucleus is the nucleus which receives impulses for pain and temperature from any part of the face. So spinal is for pain and temperature from any part of the face. The the principal sensory nucleus is responsible for carrying tactile information, all kinds of tactile information from any part of the face. And the mesencephalic nucleus is responsible for proprioceptive impulses. And even the proprioceptive, it's basically the proprioception over here is for the reflexes which are occurring, like the masticatory reflexes. So if there was pain and sensation from the eyelid, for example, it would travel in the ophthalmic division, have its, so let's say pain and sensation from the eyelid, have its cell body in the trigeminal ganglion. It would come here. Now it enters the pons, but it has to go to the spinal nucleus because that is pain and temperature. So it travels down and then comes and relays in the spinal nucleus. Suppose it was from the cheek area, again for pain and temperature, it would do the same thing. It would enter at the pons, but now it would travel down because it has to reach this nucleus which is present at the medulla or the lower pons, so even here. Same for mandibular, from the chin area, the same thing. They come down and then they relay. So as these fibers descend to relay in the spinal nucleus and they are carrying pain and temperature, you can see they are forming a tract here. This is the tract which we have been seeing, and that tract is known as the spinal tract of the trigeminal. So that was the tract which was the spinal tract of the trigeminal. Now, suppose the impulses, and I'm just going to use another color, let me use red. Suppose the impulses were for tactile information. Then from any area of the face, they would do this, they would come here. So from the eye, let's say from the cheek, and let's say from the chin, just being carried by those different branches. So they would go through these different branches. If it was for a reflex, then it would go to the mesencephalic, and that's slightly different, and I'll discuss that later. So you can see that this is the sensory component which is present in the trigeminal nerve. Now we have a motor component also, and that motor component is, if this is the midline, that motor component is present in the pons as a nucleus up here, and this nucleus is known as the motor nucleus of the fifth. So this is equivalent to the anterior horn cells, as these were equivalent to the dorsal horn cells. So these now, the cells here, they pass out and they travel only in the mandibular division of the trigeminal to go and supply those muscles of mastication and the other muscles like mylohyoid and the anterior belly of digastric. So you can see that this motor nucleus is very small because the fibers are only coming out of the mandibular division. They don't go out over here. So just to give you an example, so these were all relaying in the sensory nuclei. So these were all relaying in the sensory nuclei, and the motor nucleus is here. So you can see it comes out only in this. So can you see it's the mandibular which is a mixed, these others are purely sensory. So now, having explained this concept, let's go back to the PowerPoint and let's look at the trigeminal pathway. So here we are looking at the three nuclei that I described. The spinal nucleus is the one which is present in the medulla and goes up to the lower level of the pons. The pontine nucleus is also known as the sensory nucleus or the principal sensory nucleus. It's present only in the pons. The mesencephalic is present in the midbrain. Spinal is responsible for pain and temperature. You must know these. Sensory nucleus is for tactile information, and mesencephalic is for proprioception. You can forget this supratrigeminal nucleus. Then we have the motor nucleus. That motor nucleus they've only shown on this side, but the motor nucleus is also present here, and I just explained to you that it is for the cells from there are like the anterior horn cells. They go out to supply muscles of mastication and a few other muscles. I also explained how the spinal tract of the trigeminal was formed, because fibers which, since the nerve is attached at the level of the pons, when the pain sensations have to come in, they have to travel all the way to come and relay in the spinal nucleus. So that's why they form a little tract, and that's why at all levels in the medulla you were looking at that tract, that spinal tract of the trigeminal. This is showing you the same thing that I drew earlier. So here at this point you can see that this is the area of the trigeminal ganglion, and these are the ophthalmic, the maxillary and the mandibular divisions, and you can see that how the fibers come here and they are synapsing in the sensory nucleus. Some of the fibers they show synapsing in the spinal nucleus, and a few going up to the mesencephalic, but we'll do the mesencephalic a little later. Let's first look at the spinal nucleus and the sensory nucleus, and I'm going with your notes. So in these, let's say that the fibers have come in. They have for the spinal and sensory the sensory nucleus. So from each of the three divisions, fibers come in. their first order neurons, again to go back, the first order neurons are within the first order neurons, you can see, are within the trigeminal ganglion. They go and synapse either in the sensory nucleus or in the spinal nucleus, depending on which information, what type of sensation they are carrying. So the second order neurons will begin here. The second order neurons will begin here. And these second order neurons, they cross over. So whether they begin here or they begin here, they cross over to the other side. And here they form a tract which is called the ventral trigeminothalamic tract, or this is also known as the trigeminal lemniscus. So you can see that this trigeminal lemniscus carries sensations of pain and temperature, and it also carries all tactile information. So that's why, that's what you're looking at. So you can see here that the fibers have synapsed. This is the trigeminal ganglion. Second order neurons begin in the spinal or the sensory. They cross over and they form the trigeminothalamic tract, and this is also called the trigeminal lemniscus. And you can see that we have the medial lemniscus and we have the spinal lemniscus. So this trigeminal lemniscus kind of joins these two so that you get, tactile information going with this, and and pain and temperature going with the spinal lemniscus. So this was medial. So the trigeminal sort of intersperses itself between these two so that it distributes the information from the face to these two lemnisci. So this then goes after, as it's carried with this, remember these went to the thalamus. So now this trigeminal lemniscus or the ventral trigeminothalamic tract goes and relays in the thalamus, but it goes to the VPM nucleus of the thalamus. So the third order neurons are in the VPM nucleus of the thalamus, and then from here they go and relay in the post-central gyrus of the parietal lobe. So then from then on it's very much like the other sensory tracts. So this is the trigeminal pathway for pain and temperature and tactile information. Now what about proprioception? Now this proprioception is mainly, as I said, for it's concerned with the reflexes, but there is also information going from their muscles. This information goes to the mesencephalic nucleus. Now here there's a little bit of a difference. The first order neurons, they enter through the sensory route of the trigeminal, but they do not have their, if you remember, and we go to this, if you remember up here, they all, for the pain and temperature and tactile information, they have their cell bodies in the trigeminal ganglion. But for proprioception, they don't have their cell bodies within the trigeminal ganglion. Instead, as they go in, they travel all the way in. So they travel all the way in, and actually they have their cell bodies in the mesencephalic nucleus. And that's what I'm trying to show you here. So their cell bodies lie in the mesencephalic nucleus. And this is the only place in the brain that you need to know of where the first order neuron is actually lying within the brain, not outside the brain. So their first order neuron lies within the mesencephalic nucleus. So no relay occurs in the mesencephalic. It just has the cell bodies, and the fibers come down. So, it's like this. The fibers come down, and in fact, these are not even called pseudo-unipolar. These are known as unipolar neurons. So that doesn't matter. So the second process comes down and relays here in the sensory nucleus in the pons. So you can see it relays in the sensory nucleus. Now cells from the sensory nucleus, these are second order. These fibers either they cross over or they remain on the same side, and they form what is known as the dorsal trigeminothalamic tract. They remain on the same side or they cross over, and then from here they still go to the VPM nucleus of the thalamus, and then from there they project to the post-central gyrus of the parietal lobe. So then the order is the same, but this is slightly different. In other words, the first order neuron is lying within the mesencephalic nucleus, second order lies in the sensory, third in the VPM, and then it goes on. So this is important for you to know in the trigeminal pathway. So it's really not complicated if you understand how it works uh, with the spinal cord. Now you might wonder, in your notes I've given you, if you look at your notes, it's mentioned that afferents to these nuclei, that is the spinal and the sensory and even the mesencephalic, they come not only from the trigeminal nerve, but they also they come from the other areas of the brain, like the facial, the glossopharyngeal, the vagus, and the cervical nerves. So what happens with those is, and if we go up here, and you remember I said had the facial had a part which was from the skin of the external ear. So here what it would do is, like, if this is the facial, it would have its cell body in the geniculate ganglion. It would come here, travel a little higher up, and then in the pons or in the medulla itself, remember there was the spinal nucleus here, and in the pons it was here. So if it was for pain, this would actually go and relay here, and if it was for tactile information, it would go up and relay in the sensory nucleus. Similarly for the larynx or pharynx, if the fibers were traveling with the ninth cranial nerve, they would have their cell body in a ganglion of the ninth, but instead of having a nucleus for sensory fibers in the ninth, they would just go and synapse here and they go here. So you can see this interconnection with the other cranial nerves and the areas that they are supplying. So now with this trigeminal nerve, let's look at some reflexes which are extremely important. And one reflex we are going to look at is the corneal reflex. It's called consensual corneal reflex, which means that if one eye is irritated, the opposite eye, there is contraction of the muscles on the opposite eye also, along with the one on the same side. That's what is meant by consensual, and you'll see this in pupillary reflexes. So let's look at what happens. Now, let's see what all is involved. So this is a corneal reflex, and what happens is that the cornea is stimulated. You know, there's a little irritation to the cornea, and what do you do when something touches your cornea? You blink. Now, blinking is done by the orbicularis oculi muscle. That muscle is supplied by the seventh cranial nerve. So in other words, you have two limbs of the arc. So the sensation, the cornea is irritated, the sensation from the cornea is carried by the fifth, because the fifth is the one which supplies the entire face, and the eye, if you remember, I told you it was the ophthalmic division of the fifth. So it goes and relays in a nucleus of the fifth. Then from there, somehow the information has to be passed on to the seventh cranial nerve so that it can go and make the orbicularis oculi contract. Now again, if we want to compare this with the spinal cord, in the spinal cord, if you look here, you can see that a single spinal nerve is responsible for a reflex. So in the same nerve, the sensory fibers come in, they relay in the dorsal root ganglion. From here, fibers are connected to the anterior horn cells. The anterior horn cells go out, they are traveling in the same spinal nerve, and then they go and supply the muscle. So the same nerve carries both sensory and motor. In the case of cranial nerves, that is not so. The same nerve does not necessarily have this pathway in this fashion, because sensations from an area are carried by one nerve, and the muscle which reacts to that sensation is supplied by another nerve. So that's why in an arc, two different nerves may be involved. And that's what we're looking at in this corneal reflex. So let's look at this. So here we have the cornea of this side. So let's say this was the right eye. There's some irritation in the cornea. The cornea is irritated, impulses pass, and they pass into the ophthalmic division of the fifth, which is also given V1, we call it sometimes, or 5-1. So it goes in the ophthalmic division, and this is irritation to the cornea, and it is noticed that it goes to the sensory nucleus. So it's taken to be tactile information, not pain, but tactile information. So it goes to the sensory nucleus of the fifth. Now from here, the second set of neurons will start, and instead of going just to the motor nucleus of the seventh cranial nerve on one side, it actually connects with the motor nucleus of the seventh on the other side. And again, just to give you a brief how this would happen if I was to represent it in the spinal cord. So let's say I draw the spinal cord this way. And in certain withdrawal reflexes, we actually have it like that. So here is a sensory fiber coming in. This sensory fiber, so let me draw it, comes down. And then it connects with a motor fiber which goes out this way. But sometimes this also will go across and connect to the opposite side. So you have motor fibers going across here too. So it's just on this side, but see how it is going to the opposite side. So this is what is happening in the corneal reflex. And what happens is that in the pons and the medulla, so you have the pons and the medulla lying so close by, the impulse comes, it relays in the sensory nucleus, and the sensory nucleus was in the pons up here, and the motor nucleus of the seventh was also seen in the lower part of the pons, not here in the medulla. The motor nucleus was seen in the lower part of the pons. So there are always connections between various nerve nuclei. So from here, when it comes into this sensory nucleus, fibers from here start and they go and relay on the motor nucleus, and then the motor nuclei send their fibers out. And that is what we are seeing here. So you can see it comes to the sensory nucleus, it's brought as impulses here. Fresh neurons from the sensory nucleus travel both to the same side and the opposite side motor nucleus of the seventh. From here, the anterior horn, this is equivalent to the anterior horn cells. So the cells from here send out fibers which travel in the seventh, and they go to the orbicularis oculi of the same side, and the opposite side, they stimulate it, the person blinks on, and both eyes blink. So that's why it's called consensual, because only one side has been stimulated, but both sides show a reaction. So this is the corneal reflex. The next reflex we are seeing is the lacrimatory reflex. And remember, lacrimation is a parasympathetic function. So this is a parasympathetic function, and this is not consensual. That means it only irritates, or the reaction is only seen on the eye of that side. What happens in lacrimation? Some foreign body enters your eye. It either touches the conjunctiva or maybe even the cornea, most often in the conjunctiva. It irritates it, so there's a little bit of pain. So the fibers from there, the conjunctiva is stimulated. The fibers from there are carried, it's the eye, so again it will be carried in the ophthalmic division. They travel now to the spinal nucleus of the fifth. So they go into the pons, so they'll have their cell body in the ganglion. They synapse here in the spinal nucleus. From the spinal nucleus, cells begin, they send their axons down, but they send the axons to the lacrimatory nucleus, which, if you remember, was related to the facial nerve. So just to refresh your memory, remember the facial had the lacrimatory and the salivatory nucleus, and I showed it to you here. So therefore it goes now not to the motor nucleus of the seventh, but it goes to the lacrimatory nucleus, which is associated with the seventh cranial nerve. Fresh fibers start. Since it's a parasympathetic, we will call these preganglionic. So they travel in the seventh cranial nerve. So, they're traveling in the seventh cranial. So if I say that this is the seventh cranial nerve, they are traveling in the seventh cranial nerve. They leave the seventh cranial nerve to go to an autonomic ganglion, and that's the pterygopalatine ganglion. From there, the postganglionic fibers will start, and they reach the lacrimal gland, which begins to secrete, and the reflex is completed. So you can see the importance of this. If any limb is damaged, let's say the ophthalmic division was damaged, then what would happen? There would be no tearing of the eye if on that side there was some foreign body went into the eye. Or if the seventh cranial nerve was damaged up here, again, the same thing would happen. This would go in, but the final pathway is not there. Or even if this got damaged. So you can see, for the reflex to occur, all parts of this pathway have to be present. Let's now look at the next one, which is the jaw reflex. And this is basically, you tap the chin in a downward stroke, and then you will see the masticatory muscles, they begin to twitch. And this is similar to the monotatic reflex of in the spinal cord. So from the mandibular nerve, the fibers start from the muscle spindles. It go because you're tapping the chin. It goes up to the mesencephalic nucleus. From the mesencephalic, you can see that the fibers have come down. This is the first order neuron. They come down and they synapse in the anterior horn cells of the motor nucleus of the fifth. Not anterior horn cells. It goes to the motor nucleus of the fifth, which is comparable to the anterior horn cells. From here, fibers start out. They go in the mandibular nerve. They go to the muscles of mastication, and they begin to show a twitching, and that's the jaw reflex. So that is another of the another pathway using the trigeminal nerve. So these are the trigeminal pathways, and these are the various reflexes which are associated with the trigeminal pathway. Let's now look at the auditory pathway. And in order to understand the auditory pathway, first of all, what you have to understand is that it is what is known as a polyneuronal system. That means all this while, we either saw that sensations were 2 neuronal or 3 neuronal. In the cerebellum, they were 2 neuronal, and in the others, they were 3 neuronal. This is polyneuronal, means that there are more neurons involved, and it can start out as being, anywhere from 3 to 5 to maybe a few more also. So it involves many neurons, and so the pathway is therefore called a polyneuronal. There are many synapses. The second thing is that it is a bilateral pathway, so it goes into both sides. So therefore, a hearing loss is never absolute because it is represented on both sides. So let's see how it starts. So we always have, like the dorsal root ganglion, we always have a ganglion present. That ganglion is the spiral ganglion, which belongs to this vestibulocochlear nerve. And since this is hearing, the nucleus, the part of the nerve and the nucleus will be cochlear. So it's the cochlear part of the vestibulocochlear nerve, and the nucleus involved will be the cochlear nucleus. So the spiral ganglion will have the first order neurons always. So this is like the dorsal root ganglion. And then this goes and they will synapse in the cochlear nuclei. So these are the cochlear nuclei in the brainstem. They are present. There's a dorsal and a ventral cochlear nucleus. So they synapse either here or they go here. From here, they can do a lot of things. They can either go all the way across, go up this way till they synapse in something called the medial geniculate body. And then from the medial geniculate body, they will go from the medial geniculate body. They will then go to the temporal lobe, which is the hearing cortex or the auditory cortex. So you can see now this is 1, 2, 3 neuronal. Otherwise, another thing can happen. They can actually go here, synapse here, follow this pathway and go this way. Or from here, they can synapse here. Then you may have fibers synapsing on this side. Now they go this way. And this crossing over, which occurs, it will be occurring from the other side. This is the crossing over. This is what forms that trapezoid body in the pons. This is the area forming the trapezoid body in the pons. Now, as they are traveling up and going this way, as I've shown, this is what forms the lateral lemniscus, which I told you was the auditory pathway. So this tract which is formed, and it consists, as you can see, of second order neurons, third order neurons, little fourth, so on. This is what is called the lateral lemniscus. Now, in this lemniscus, there are some nuclei present. So there may be a nucleus present here. So some fibers may go and synapse in the nucleus before they go all the way. Now, it's not even that simple. There are nuclei interspersed on the way, and I'll show you these nuclei. So sometimes instead of going straight, they go this way, then they go, and synapse. So you can see, therefore, that there may be multiple synapses in the final pathway. That's why we call this a polyneuronal system. So now let's look at this. And here we are looking at the auditory pathway. So we'll see the point where it begins. So the fibers begin in the internal ear, which is this one. So this is showing you the internal ear. And in the internal ear, there is something known as the spiral organ of Corti. So this is the spiral organ of Corti. And that's where they begin. And this is located in the cochlear duct. And it has special receptors which are known as hair cells. These hair cells, they receive the peripheral processes of bipolar neurons. This is a special pathway, so the neurons here are bipolar. They are not, pseudo-unipolar. So the one process is present here, which relays on this receptor, and then this will come out, and it will have its cell body in the spiral ganglion, which is this, and the second process is the one which will travel out this way. So this process really is coming into the spiral ganglion, has its cell body here, and then it passes in through the cochlear nerve. It gets into the medulla. So this spiral ganglion has bipolar neurons. Now let's see what happens. So this was the first order neuron. It comes here, and then it relays on the cochlear nuclei, which are these. So it may relay either in the ventral cochlear nucleus, or it may relay in the dorsal cochlear nucleus. Some of the fibers from here, you can see they relay here, they travel all the way, and they go this way and form the lateral lemniscus. This lateral lemniscus will travel in, it'll pass all the way up, and it will go and it may synapse in that inferior colliculus, and from there a third neuron will start, and it will go to the medial geniculate body. Or some fibers may travel all the way up and then synapse in the medial geniculate body and then go to the temporal lobe. So you can see that there'll be just 3 neurons in that case. From here, cochlear, from cochlear all the way through lateral lemniscus to the medial geniculate, and then into the temporal lobe. Now some of these second order neurons, what they do is they synapse in the cochlear. From here they go and synapse in another nucleus present in the region of the pontomedullary junction, which is known as the superior olivary nucleus. So this is called the superior olivary nucleus. They synapse there. Some fibers remain on the same side, some fibers cross over. So they can do either of the same thing. And then they travel in the lateral lemniscus. And as they cross, that's where they form what is called the trapezoid body. They form this trapezoid body. Now, some of the fibers will synapse in the nuclei of the lateral lemniscus. And just to show you that, let me just go to the next slide, which actually shows you these. So you can see how these nuclei are interspersed all along the pathway. So you have the cochlear nucleus, then you have the superior olivary nucleus. So let's say the the first order neuron was of course in the spiral ganglion. So cochlear is second, the superior olivary nucleus. Then you have nuclei within the trapezoid body. So a synapse could occur at each of these levels. Then it forms the lateral lemniscus. You have nuclei interspersed in the lateral lemniscus. So these are the nuclei of the lateral lemniscus. From here they go to the inferior colliculus. If you remember, I told you the inferior colliculus was part of the auditory pathway. So they're going into the inferior colliculus. Some of them synapse there, then they may go straight across, or they pass through that brachium which connects it to the medial geniculate body. So that's the 7th nucleus along the pathway. And then from there they go to the primary auditory cortex, which is present in the temporal lobe. So it's not that they have to synapse at each one of these nuclei, but I'm just showing you that how this is the pathway, and they can synapse at different levels. So that's why you have so many synapses occurring. So that's the order which has been given to you. So it goes from the spiral ganglion to the cochlear nucleus. From the cochlear nucleus, if it wants to synapse, it can synapse at the superior olivary, or just travel straight across and go up. And then third order neurons, if it does synapse in the superior olivary, it passes on both sides. And when they decussate, they form the trapezoid body. Fourth order neurons may arise in the nuclei of the lateral lemniscus if it synapses, or it may go and synapse in the inferior colliculus. If it does synapse in the inferior colliculus, then it goes to the medial geniculate body. From the medial geniculate body, it goes to the auditory cortex. So what I want you to know is the order in which a neuron can synapse. In other words, it can't go from the cochlear nucleus, synapse in the medial geniculate body, then come to the inferior colliculus and then go. So there's a definite order in which it has to go. So it will be the cochlear nucleus first, then it is the superior olivary nucleus, then let's say the nucleus of the trapezoid body, then it is the nucleus of the lateral lemniscus, then from here it is the inferior colliculus, from the inferior colliculus it is the medial geniculate body, from the medial geniculate body it is the temporal lobe. So this order I want you to know. So in other words, if you get a question like fibers go to the cochlear nucleus, from the cochlear nucleus they go into the nucleus of the lateral lemniscus, from the nucleus of the lateral lemniscus they can synapse in the superior olivary, then go to the medial geniculate body, from the medial geniculate to the inferior colliculus, and then to the temporal. That's wrong. See, if it has to go, it has to go in order this way. It doesn't necessarily have to synapse all the way. It can just go this way, come this way, and go out. But if it wants to synapse, it has to go in this order. There's no backward direction. It has to go in a pathway. So in other words, you need to know what is the order and where they lie. So cochlear, superior olivary, the trapezoid body, the nucleus of lateral lemniscus, inferior colliculus, medial geniculate, and then the auditory cortex. So that is important for you to know. Let's now look at hearing and deafness. Obviously if there is a loss of hearing, you end up with deafness, and deafness is of two types. One is called conductive deafness, which means that there is some problem in the conduction of sound. Let's look at conductive deafness. So that means there is some problem in the conduction. So here we have the external ear, and then we have the external auditory canal. This is the middle ear, which has those three ossicles. So I'm just going to draw it here. So middle ear, and then this passes it to the inner ear. So this is where the semicircular canals and the cochlear duct up here. So if there's a problem, let's say there's wax up here in the external auditory canal, so naturally sound cannot pass through because it's blocked by this. Or if there's otitis media, which is inflammation of the middle ear cavity, so this is filled with fluid, so sound passes in, but now it's not allowing the ossicles to vibrate, so again it cannot go into the internal ear. So this is what is seen in conductive deafness. In sensory neural deafness, in order for sound to finally be heard, it has to pass through this internal ear, through that nerve, which is the cochlear nerve, and then it has to go to the temporal lobe, which is this area. So now in sensory neural deafness, toxins or drugs or prolonged exposure to loud noise which damages that spiral organ of Corti, or infection with various viruses again damages the nerve. In old age, the hair cells get damaged, or there is a tumor in this nerve pathway. So it's a neural pathway that has gone. So it's an internal ear or the nerve problem that is occurring. So that is known as sensory neural deafness. Now, how do we do these tests? So we do two tests, and in the test what we compare whether it is a conductive type of deafness or it's a nerve type of deafness. And then we also want to see whether air conduction is better than bone conduction or vice versa. And the two tests we employ are known as Weber's test and Rene's test. So let's look at these two tests, and the next image shows you that. So here we have this, the first one that we are doing is the Weber's test, and this one is Rene's test. These two are Rene's test. Now what Weber's test does is it compares bone conduction in both ears. So let's say that you strike a tuning fork and you place this vibrating tuning fork on the vertex of the skull, this top point of the skull, and you ask the patient how he or she hears the sound in both ears. If the ears are normal, the sound is equal in both ears. So if somebody has normal hearing, their sound is equal in both the ears. If there is conductive deafness, so the person had some problem, there was wax in the ear or something. Now when you place the tuning fork on this, you're at the impulse, the vibrations are passed directly through bone, so it doesn't have to go through air, so that a blockage is bypassed. So the person will tell you that now they hear the sound better, so the sound is heard better on the diseased side, better on the diseased side in conductive deafness, because now it's bypassing that, traveling through the air, instead it's going through bone. If this person, on the other hand, has partial nerve deafness, it's always partial, because if it's total, then they cannot hear at all. So partial nerve deafness, then what happens is they say that because you'll see why in the next, the Rene's test should explain that. If a person has partial nerve deafness, then they say that the conduction is heard better on the normal side. So that means they hear the sound better on the normal side, because the disease side is not conducting any impulses. So they say that on the normal side, they're hearing better when you put the tuning fork, and on the disease side, they don't hear it, because anyway, it's not, the disease part is not conducting the impulses. So that's what happens in Weber's test. In the Rene's test, which is this one, this compares air conduction to bone conduction. And normally air conduction, it persists twice as long as bone conduction. So normally air conduction persists twice as long as bone conduction. So what you do is that you place a vibrating tuning fork on the mastoid process. So this here is the mastoid process of one ear, and you cover the other ear. You have to make sure that the other ear is covered, so that the sound is not transmitted through the bone. So you place the vibrating tuning fork on the mastoid process, you've covered the other ear, and you ask the patient to tell you when they don't hear the sound. So the moment they don't hear the sound, now you take that vibrating tuning fork and you place it in front of the ear, like up here. It's no longer in contact with the bone. In a normal person, so let me just see this. In a normal person, they should hear the vibration in the air. So they should hear the vibration up here after bone conduction has gone. So they say that I can't hear it anymore here. You now place it in front of the ear. They should hear it. So air conduction is still heard. And that's because, remember, I told you air conduction persists twice as long as bone conduction. So this person is normal. Now let's say that if a person has unilateral conductive deafness, so let's say this side was where it was a problem, and obviously it's a conductive deafness, that means there was a blockage in the external auditory canal or in the middle ear cavity, and so now you put this tuning fork on the mastoid process. They will be able to hear the vibrations, because obviously now it's being conducted through bone. And then now when you place it in front of the ear, they tell you they cannot hear. So they cannot hear air conduction, because obviously it's not going to be transmitted, since there's a block up here in the passageway. So these patients, they can't hear the vibrations in the air after bone conduction has gone. So this is what is seen in conductive deafness. If somebody has unilateral partial nerve deafness, these people will be exactly like the normal people. They will hear the vibrations in the air after bone conduction has gone, because of some of those nerve fibers which are still conducting the impulses. So it passes through. So it will be almost like the normal one. So they can hear vibrations in the air after. So they can hear the vibrations in air after they no longer hear bone conduction. So this is what is Rene's test. So this tells you. This compares, as I said, air conduction to bone conduction. So that completes the trigeminal and the auditory pathways, and now we have completed the entire brainstem. So you actually should be listening to this brainstem in three different parts, because I did the first part where I covered the medulla, then I did the pons and the midbrain, and now I've done the trigeminal and the auditory pathways.